Good afternoon, everyone. Thank you for being with us. I'm joined today by Congressman Pete Sessions, who has a new health care bill that he's going to drop in the near future. And he's here today to give you a preview of what's going to be in that bill. Pete and I have known each other for a long time. We've worked on different projects. About 4 years ago, I helped Pete and Senator Bill Cassidy with the bill we called the world's greatest health plan. And I really think it was, because I look around the world, there was really nothing better than what they were proposing. But in the time that's passed, Pete has decided to come back to health care and introduce a bill that I think is even better than the bill we had 4 years ago. And so we're really grateful for him introducing the bill and being with us today. Pete, thank you for being here.
Dr. Goodman, thank you. The Goodman Institute and Americans for Prosperity, AFP, have really contributed, as well as other physicians, to making this not just a consensus bill, but I think what modernizes and prepares America's families and individuals for a brighter healthcare future.
Well, thank you so much for doing this. There are not many in your party who prioritize health care, and thank goodness you're there to pick up the flag on this. Let me just give you a number that comes out of recent survey of what's been happening in the market where people have to buy their own health insurance. It turns out if you take a family of four and you take their average premium and their average deductible and you add them together, it turns out it comes to $25,000. So this means that the average family in the individual market today, the plan they're most likely to buy, they have to spend $25,000 out of their own pocket before they get any benefit from the plan. Is that affordable health insurance?
No, it's not. And as we recall, President Obama entered into the marketplace that has really, while it provided President Obama with his idea of what he thought should be health care, in fact, Obamacare is the one that is the most radically difficult, not just to pay for, but to provide services from. And so, as you suggest, the average family needs to make sure that they can look to Washington and have some parity in this. And that is why you've invested so much time with us, because Republicans care about literally average Americans, the middle class of this country, and in lots of circumstances, self-employed people that don't have the advantage of working for a large corporation.
You know, I can't resist saying this, but when President Obama gave us Obamacare, he had his own doctor traveling around with him, so he didn't have any health care problems.
Well, there's no question about that. There's a disparity. But I think that policy, good, wise policy, that the Goodman Institute has been a part of for years is to not just bring parity, but bring modernization. And the modernization, taking the newest and best ideas, not just that we've come out of COVID, Dr. Goodman, but taking these forward to where a person can get the health care, even if it's the old concierge physician, where you could get your own. We need to update the laws. We need to make sure that people have a chance to get, whether they're 40, 50, or 60, but can continue that through their life.
Let me give you one more number. According to surveys, the average deductible in the individual market where people have to buy their own health insurance, the average for families is $8,500 or more. And what that says to me is the average family is not going to reach that deductible unless somebody goes in the hospital. So they're not going to get any benefit from their health insurance unless somebody's hospitalized. Is that what we were promised?
Well, that's the Obamacare model, and I was on Obamacare, the Affordable Care Act, which is the corresponding joke to this plan. All members of Congress that received employer-provided health care were on Obamacare, and there are lots of characteristics about it that it failed to meet their own test. Not only if you want your own doctor, you can keep your doctor, which is not truthful, but perhaps more importantly, you were paying into a system that you first had to match this high deductible because we were in an individual policy basis. And so everybody was strung out before they even got to their health care.
Here's something I don't understand. We're looking at these numbers, we're saying this is terrible, and yet over the last decade I can't remember a single time when either the Republicans or Democrats, whoever was in control of whatever chamber, we never held a hearing on any of this. Can you explain that?
Well, in fact, you're right. The Democrats want de facto, they want Obamacare, they want what was there. By the way, Republicans, I think I was a part of that team, did such a great job to tell the truth about Obamacare that they don't. That is not what they prefer. They now sell Medicare for all, which is also a bigger fraud because it's senior health care. It's not designed for children. It's not designed for people who are disabled. It's not designed for families. So, you're right. This Congress should hold a hearing with a direction for what they want, and that's why we're coming out with our new Modernization Act.
Okay, wonderful. And it's called what? The Healthcare Fairness for All Act? Okay.
And Modernization of 2023.
Okay, now can you, we see that right now they're facing these horrendous premiums, horrendous deductibles. If we passed your bill, how would things be better than that?
Well, they would be better, but what we have done is, first of all, added across the board the ability to have parity. So if you're in employer-provided health care, you receive not just your premium, but your insurance on a pre-tax basis. If you're a realtor, if you're a single, a lawyer in your own practice, you don't have these advantages. Everything is after tax, which means you don't get that advantage. What comes with the advantage is also is this $5,000 that you can use on a pre-tax basis to pay for your drugs, to pay for ancillary things. So what we want to do is to offer a chance where every single American, now we're not talking about competing against Medicare. Okay. We are an opportunity for American citizens to be able to get the parity through the tax system. And that would be called a tax credit. Not something that passes to a person with cash, but something they can apply, refundable. And it would give them the ability, a family of four, a husband, a wife, $4,000 plus $4,000, then $2,000 for each child. That is 8 and 4, $12,000 that in a given October or November circumstance, they could go online, go to their healthcare provider, apply the first $12,000, buy a group plan as opposed to an individual plan, and then receive the parity and then move forward. Why is this important? Because people show up uninsured. Sure. It's a huge impediment in the marketplace, not only for what kind of coverage, but also the bills that come from that. It causes lots of harm in our society. So we're looking for parity. Next, the best ideas that are in the marketplace today to modernize us, to allow us to give to people, not just things that come out of COVID era, but real live answers to where we can allow them to have like a Roth HSA available to everybody. So this is these what we call the 10 new best ideas, and they come from different groups who have called for these. We simply take the best ideas and put them into one package.
Now, when you say the different groups, we're talking about really over 80 think tanks and activist organizations who came together and endorsed a big plan called Healthcare Choices, but 10 of those really good ideas we pulled out and are in your bill.
That's right. They are in the bill.
All right. So, so a lot of people have had some input into this. Now, here in Texas, people can buy something called short-term insurance. The premium's half or a third of what it is in the regulated individual market. Democrats in Congress have criticized these plans. They say They don't always cover substance abuse, and you may not have anybody in your family that you think has a substance abuse problem. So you join the plan, and they say suddenly you discover your child has this kind of problem, and therefore they want to eliminate by law this option. What do you say to that?
Well, I say that if there is coverage that's available that people want and need, that's great. In fact, our flexibility that we have in this bill would allow them a chance to buy what they would choose to buy. And as you know, the father of HSAs, I'm sitting with the father of HSAs who invented what would be a realistic opportunity for a family that wanted not just choice in what they do, but flexibility to meet their needs. Those would be available also today. So I'm for it. Customers and consumers and families need these options, and they're available.
Okay, so not to put words in your mouth, but right now, the only thing available in the individual market that's regulated is a plan designed in Washington by members of Congress. But you're saying people should have an opportunity to buy health insurance that meets their needs, which could be very different than what Congress thought they should have.
No question. Well, okay. This is sort of the ERISA model also, where we've allowed large companies that go across state lines to offer their services. This was the HSA model, where you would be able to get what might be called a major medical. If you went in the hospital, you still had to purchase that, but it gave you cash for the rest of the options that you needed. And if that wanted to be one of the choices that was offered by a state, we'd be for it.
Now, your bill, as I understand it, does not abolish the Obamacare market exchange. It's still there, am I right?
I think it would be a mistake to come in and destroy something that is literally free health care. A huge number of people are given almost health care for free. The amount of money that a person makes would determine that, but we're trying to provide options for people that are not employed by an employer that has health care, self-employed people. And so that's the marketplace. There's about 147 million people that we believe reside in this instance, and they either don't buy health care because it's too expensive, or it's ungodly, inflexible, and expensive. We need to bring them to a model that's more like something that they can afford, something that provides them the coverage that they need and gives them the options, and is modern.
Okay, so to go back to the Democrats' criticism of the short-term plans, the family joins, they're paying a lot less than they're paying today. It's meeting all their needs. Suddenly we discover one of the children has a substance abuse problem. Am I right in saying that family, if they're not satisfied with where they are, they can go over into Obamacare, where there's no penalty for health condition, and does cover substance abuse, and take advantage of what's there? Is that right?
Well, they certainly would have that flexibility and option, but okay. I would caution them to understand those surrounding or corresponding issues go away very quickly. We learn this about the frailties. Number one, if you have any disabled children, no children's hospital in the country takes Obamacare. None. And so if you have a child that needs a specialty that comes from a children's hospital, you can't get it. And that's because they won't accept reimbursement of such a level that is so diminished. Secondly, if you have cancer and you are wanting to get the advice and consent from an oncologist that specializes in anything, breast, bladder, you could name it, the Obamacare model does not allow you to go to a specialist. It goes to an oncologist that they would choose. And if there's one thing we have learned, John, is we've learned that over time we have been more successful in cancer because of information, treatment, and specialists who have learned how to control and help people live longer. So those are just two examples of what a person, if they think they're buying into health care, they're not getting the market best offer or availability from physicians.
Okay, so you and I are sitting here in Dallas, Texas today, and I think you already know this. UT Southwestern Medical Center is one of the premier medical centers in the whole country, really in the whole world, and it's right here in our backyard. And as I understand it, you can't buy individual insurance to get you in there. And down in Houston, we have MD Anderson Cancer Center. They don't take what you're calling Obamacare insurance, and this is a problem all over the country. And you envision that your bill would change that in some important way. Can you tell us kind of why that would happen?
Sure.
Because people can buy real insurance instead of regulated insurance?
Well, I think the important part of this that we have been aiming at for a long time deals directly with the ability to have same or similar health care, just like I had at my former employer, AT&T. AT&T offered a robust plan. You could get an HSA, you could get a PPO, you could get whatever you chose to get that meets your family needs. But the characteristics behind that are empowered by law allow you to get things on a pre-tax basis, which meant your employer could come and add to that and encourage you to have health care. If you do not have what we call the Modernization Act of 2023, you show up, if you do not have the employer-provided health care, at the whim of wherever you show up. And that's where these staggering bills, of which people write, not just me, but other members of Congress, and they write and say, I was there for 86 minutes, an hour and a half, 90 minutes, and I was there, and I walked away with a $12,000 bill. That's because they did not have coverage before they walked in. I don't think any family wants that, but they've been thrust into that position, a gamble that they would not need health care because they can't afford it. And when they did, it was based upon an individual, not a group. So we are trying to solve problems. We're not going to attack Obamacare. We're not going to attack anybody else, but we're going to give darn parity, which is important to people to have coverage.
So, what we get, I guess we need to say is, if you're in one of the Obamacare plans that are offered in the regulated individual market and with very narrow networks, exclude UT Southwestern. If there was a doctor over there that I needed and I went there, I pay 100% of the bill. They pay nothing. And that's true even of the Blue Cross plans that are competing in this market. Your bill would let me go over there.
The bill would, but what it would do is create more competition where people could come and sign up and be a part of something. So you've now talked about what's called surprise billing. You've now talked about reality billing, where there may be a storm in Houston, Texas, and people leave and they're away from their in-network provider, and they go to a person who can see them. We believe we're going to help them show up without, even though they would walk in out of network, they would walk in with some coverage and hope that those state laws correspondingly would net those out, just like is done in car insurance. Netting out. You charge me what I would charge you, reasonable, normal expenses, and it will create a new opportunity for people to put this problem behind us. It will be partisan. It will be political. But our biggest impediment is knowledge from a member of Congress who can come and ask for something to make things better for a huge number of people in every single state and every single district in this country.
and we appreciate your role in that. You know, I hate to admit it, but I'm old enough to qualify for Medicare, and I'm in a Medicare Advantage plan. And again, we're here in Dallas, Texas. I go over to UT Southwestern whenever I have a problem. I do something that younger people in the Obamacare plans can't do. And the question is, well, why am I able to do what they can't do? And the answer is that my plan gets an extra premium payment if it has sick people in the plan. That doesn't happen in the Obamacare market. And as I read your bill, we're going to have the kind of risk adjustment which makes sick people attractive, financially attractive to health insurance. And so instead of running away from sick people, they have an incentive to treat the problems of the chronically ill. That's huge.
Well, it is huge, John, but there's also more to that. As you know, the Obamacare model is you come get your coverage, and at the end of the year, we settle up. We offer this based upon really good feedback from Americans for Prosperity, which has been a part of providing this feedback, and the Goodman Institute that said, let's go and offer parity. Let's make sure that the people who this was intended to help, it helps them. Let's not do what the Democrats have done, throw out a false ceiling, a false narrative, and then pull the rug out from underneath people. We believe this answers the modernization of 2023. And it is not just through taxes, but also it empowers the healthcare network to want to see someone, wants to be able to take care of them, and knows what they'll be receiving back to where there's less fight and more action on getting resolution for your healthcare problem.
Let's talk about the fast food workers. Before there was the Obamacare regulation, people who work for McDonald's and Burger King, these are young people, they're healthy, they have families, they don't have any assets, low income, and employers would typically offer them a Blue Cross, standard Blue Cross plan that covers just about everything, but it has a high deductible and extra premium. Or for free, they could have what I'm calling limited benefit insurance that pays, let's say, the first $50,000 or $100,000, but nothing above that. And given that choice, they all chose a limited benefit plan, and the reasons because they're young and healthy, and their worry is they wake up in the middle of the night and the kid is sick. Can I afford the emergency room? Or the next day, can I afford the doctor's visits? That's what they want coverage for. So would you allow that?
In fact, we want the flexibility to be there, but we believe that the amount of money that we would be providing could be an incentive for someone to come into that plan. And if you have a single mom, uninsured today, perhaps she's in Obamacare, maybe not, because they still work, would this be an option for them? And the answer is, she would get a $4,000 and the child $2,000 contributed to them to have a plan that can meet their needs. That's $6,000. Now, could they have been getting this for free under Obamacare? Yes, they could have. But the bottom line is that it is limited in scope, it's very costly, and you probably had this huge deductible to meet rather than getting a plan that would correspondingly work to any doctor you needed to see.
Tell me if this is a fair description of your approach. The Obamacare model is we're going to force private insurers to cover everything, no matter how expensive the event, no matter how rare it is. And when you force an insurer to cover the very rare, expensive event that's way out on the tail of the distribution, you screw up the whole market. The way I think of your plan is you have a division of labor. You let the private sector is free to solve the problems it can solve in the most efficient way, but there's a government safety net that's backing it up to meet the needs it can't meet and the private sector cannot meet. Is that fair?
I think it could be. I don't know whether it's a backup or a straight out saying we'd like for you to go get the plan you want. Okay. And there are frailties and everything, but And the frailty in the model you just talked about is a government backup, in fact, is very limited in scope and nature and does not work for people really when you get down to it, especially if you're sick and especially if you have cancer.
So one of the questions Jimmy Kimmel asked Senator Cassidy on national TV, he had the misfortune to have a baby that had, I think it was premature. In any event, very, very expensive.
$1 million babies.
$1 million baby. So let's discuss that for just a moment. If a family has the $1 million medical problem, but they don't have insurance that fully covers that, what happens?
Well, good question. And the answer is that if you're in the individual market, which Obamacare is, and which many today plans only offer to people without employer-provided health care, you're, in essence, penalized. You're held accountable because you had this baby. As you know, Dr. Goodman, my wife and I had a Down syndrome child.
I do know that.
And while Alex was not in the early run necessarily needing all the coverage, within a year he was. We could go to what was Children's Hospital. He got coverage, he got needs. So, of course, Mr. Kimball, that is the point of having a good health care plan as opposed to Obamacare.
What do you do about telemedicine?
Well, first of all, we believe it should be here to stay.
Okay.
It was a part of what we had this guy's name is Donald Trump. And Donald Trump, as president, dealt with this issue and put the correct procedures in place to allow it to take place. As we all recall, a lot of people live out in rural America, and they need to be able to have the advantage of not just telemedicine, but to incent the doctor to be reimbursed to take the time, could be a part of surgery. We pay for and allow that as part of the coverage.
Some of our viewers may not know this, but when Donald Trump was elected, it was a law of Congress that said Medicare doctors can't do telemedicine except in rare circumstances. And COVID comes along, Congress passes a medical emergency, not permanently changing things, but temporarily changing things. Trump jumps in, as you said, with an executive order allowing telemedicine, not just under Medicare, but also for younger people, waiving the privacy problems. Now the medical emergency is going away. Trump's executive order is not codified, but your bill codifies it and makes it permanent.
Makes it permanent.
Okay, very good.
And we believe that this should be a part of America's having the greatest healthcare system. We have to remember not everybody lives next to UT Southwestern.
And that's too bad for them.
Well, we still have people who choose to live somewhere else.
Of course.
Just to live. I mean, taxes in big cities are outrageous.
Of course. You know, doctors at Mayo Clinic can treat stroke victims out in many rural hospitals where they rarely ever see a stroke victim, and they're saving lives, and they're saving the quality of life for those patients. And I'm so glad you're going to make that a part of
this is part of the feedback with you when you get to these 10 best ideas.
Yeah.
There are people that know how to fix this. We simply, when I was at Bell Labs, we used to have a saying, if you take an idea from somebody and use it, that could be called plagiarism. But two is research. And so we have now included research of looking across the landscape at the best ideas, bringing it in, modernizing healthcare for what we believe is virtually everybody.
Portable health insurance. What does your bill do about that?
Well, it allows it.
Okay,
we believe that when you start something, you ought to be able to continue it, and it does not discriminate against that at all.
You know, something, again, our viewers may not know, when Donald Trump came into office, this was illegal. The employer could not give pre-tax dollars to an employee to go buy his own health insurance. We have an executive order, which I think hardly any employer really knows about, but they can give money to their employees to buy their own health insurance today. But again, that's an executive order. It could easily be rescinded by the Biden administration, which has rescinded a lot of stuff that Trump did. So it's very precarious.
By the way, you know that President Obama signed into law, because these darn Republicans came back after Obamacare was law, some 13 items that we then said, well, it's happened now, but it's inefficient and not worth the, in any visualization, it doesn't make sense. They did it simply to tax the American people to pay for the darn bill. President Obama signed 13 different changes in Obamacare while he was president.
Wow. So your bill allows, it's now codified, the employer will be able to give his employee money to buy their own health insurance. They can take it with them from job to job, in and out of the labor market. And every poll I've ever seen says that's really popular.
Well, it would be popular, but it's also necessary, because we all, in today's environment, we don't always stay with the same employer. And there might be a deal cut to migrate people to a new job. And today, in lots of respects, all you have is COBRA.
Today I would say very few people work for 40 years for the same employer.
I think there's truth to that.
So we used to call concierge care. Today it's called direct primary care. You got your doctor's phone number. You at night and weekends, instead of going to the emergency room, you call up and get a consultation before you do that.
Limitations on that.
Yeah. All right. So what does your bill do about that?
Well, we allow it, and we're open to this. We believe that the flexibility into a doctor who would like to provide their own services to a group of, whether it be 50 or 500, would be able to be on call, as you suggest, 24 hours a day, be able to know their patient, and be able to gather their practice around a group of people that they would need to be reimbursed for, and that correspondingly could be used within the law, as opposed to going outside their existing health care today to pay for it.
So now the way these direct primary care doctors work today is they get a monthly fee. And by the way, the prices come way down. That's why they don't call themselves concierge doctors. It's a mother with a child. It's about $50 a month for her, $10 for the child. Not very much money, and they get all primary care. But what cannot happen under current law is the employer can't put money in the employee's account. So you choose the doctor, you make the payment. Instead, the employer has to choose the doctor for you. Now, as I understand your bill, now, if your bill were law, the employer can put money into the account, the health savings account of the employee. He can choose his primary care doctor, right?
John, it's so essential. And once again, about 1 in 5 families have a person that is within their family that needs specialty care, that needs the things that may not be involved in a system, may not be involved in an area. And there are experts. Healthcare in America, when we can still tout we have the greatest system in the world, that's because we're not told what to do or limited by the government, but rather they can go and offer the best advice that's available, and that would be well within the plan.
Now, I want to show you a chart that was prepared by the Goodman Institute and the Americans for Prosperity. Colby, can we have the chart? And it shows where the government subsidy money is now going. And what you have over on the left-hand side is the income as a percent of the poverty level, and then you have the actual income. And then we have what happens if the individual's out there on his own, what happens if the employer purchases a plan. And by individual, that's kind of misleading because this is a family of 4.
It is.
And their plan, if they didn't get any subsidy, they have to pay $16,000 for the plan. And then when you add on the $8,000 out of pocket for a deductible, that's how you get to $25,000. So here's this family, and if they're in the individual market, they get $16,000 plus of subsidy. The same plan, if they make only $45,000.
This is a household.
Yes, this is a household. So the plan costs $16,000. They only make $45,000. But if they go into the individual market, the government pays for, as you said earlier, some people don't pay anything. This family pays nothing. They make $45,000. Their plan is fully covered by the federal government. If that same plan were offered by the employer, they get only $3,000 of subsidy, which is a fifth of what they would have gotten over in the exchange. Is that fair?
It's not fair. And it puts, it's really, John, at the most simplest level, why work?
Yeah.
And yet, that's what we want to encourage people to do. So that's where hopefully we make a difference and come in and add some parity to that. But work should be important to families over the long run, to have a job, to go to the next quadrant up, to take care of themselves, their own health, their own children. But a Republican, and we admit this is a partisan idea, we need people to go to work without losing their benefits. If we were to say, well, you got to go to work and too bad, you start back over, but that's not true. So Republicans, I think, have a great message here. We simply need to encourage it.
So I'm glad you're doing this. Every other day I seem to read in the newspaper about somebody saying, well, the Uber drivers are so mistreated because they don't get benefits from an employer. Looking at this chart, it looks to me like the Uber driver is making out like a bandit buying his own insurance because he's not going to have to pay anything for it. If he were an employee of Uber, he gets none of that help. Well, he gets a fifth of that help from the federal government, which means his salary would be his pay would be a lot lower. Health insurance at this level is so expensive relative to income that I think it has and it is changing the whole job market. Everybody below average income is now incentivized to be an independent contractor and not work for an employer.
Well, now remember that it is a Democrat Party idea. They want to do away with those also. They want you to be attached to an employer. And that is where this has been a vicious model of destruction, in particular in California and in Oregon, to where people who are independent contractors, people who own their own truck, who own their own business, but who worked with companies to add, in particular, specialty items, they want to take that status away. And here's another reason why that's destructive, not just to the economy, but to the family behind it.
What we should have said is the chart we're looking at is the subsidy structure for the first 7 years of Obamacare before they did the extended subsidies that I'll talk about in just a moment. But what's clear from this chart is if you don't make very much money, you do get a lot more subsidy if you're over in the individual market. But if you make over $100,000 or so, you get nothing if you purchase on your own, but you get a subsidy through your employer. So I guess this is why you titled your bill the Healthcare Fairness Act, because you're going to do what? Give everybody the same benefit regardless of where they are?
We're going to give them the same benefit. We're trying to build parity, but what we're trying to build here is a model that you can count on, as opposed to the model that later we got to find out what we got paid to find out where we are. And we think stability is very important.
Let me ask you something about the Democrats in Congress.
I've heard of them.
They surely were aware of what you and I are looking at. And they also were aware that everybody who wasn't getting a subsidy wasn't buying. It was just in a death spiral in that part of the market. Meanwhile, over here in the employer market, the people working for the fast food restaurants, they weren't buying into these expensive employer plans because they couldn't afford them. So what did they do? They didn't do anything to help the low-income worker. Instead, they had extended subsidies for high-income people. In fact, you can make $500,000 right now and get a little bit of subsidy from the federal government. But if you work for McDonald's, you don't get any new help. Why do they do that?
Well, it's done to drive behavior. They want to know that you're going to work for a union organization. They want to punish those that work in the free enterprise system. They go to work. and they want to change your viewpoint of what you would want to get and receive back to a model that they want. But this is the way the Democrats designed it. We simply are not trying to change that. We're trying to bring parity and to allow competition against that, or choices. And I think that if there's one word that Dr. John Goodman believes in about as much as anybody is, don't define where I've got to go. Give me opportunities to have choices. And we believe it's a choice.
And your bill as now written is pretty generous. For a family of four, what do they get? $12,000?
They would, and that may be generous, but costs of health care are increasing at a rapid rate. And we believe you've got to meet the market needs. Are people going to have to pay and have skin in the game? You bet. But it has to be an incentive, because we're paying for this in lots of other ways, Dr. Goodman. We're paying for it in uninsured. We're paying for this in write-offs from hospitals. We're paying for this in exorbitant bills that come to problems with lawyers, that come to problems with credit, that come to problems with destroying a family's ability to be able to get over this and to move forward. We want people to have coverage. We want people to have what might be a group plan, but perhaps more importantly, we want to fit their needs.
Okay, Pete, I want to congratulate you on putting forth this bill. I hope the rest of your colleagues in the House will get behind it, and I hope Senator Cassidy and the folks in the Senate will too. It's good to see a Republican showing this much attention to health care. Actually, you're showing more attention to health care than the Democrats in Congress are showing. I don't think they're really carefully looking at the problems they're trying to solve before they spend all this
Well,
money.
once again, they do not have answers, and they are stuck with an administration that increasingly wants government dependence, or people to have government dependence, not even go to work. The Surgeon General today, on or about the 3rd of May, 2023, came out and said, a major factor that is involved in healthcare is loneliness. Well, that comes from people being stuck in their own homes.
Worse
That
than
is
15
what,
cigarettes a day, right?
equal to the same damage of 15 cigarettes a day.
Yeah.
And they may be staying at home, and they may be doing this, but this combined with marijuana usage, drug that turns into addiction, that turns into drug usage, is driving our emergency rooms to where they are seeing an ungodly amount of influx of people who have mental instability. They come to the table with addictions and things that make it very difficult to turn around. That's what families, and death, and that's what families are facing today.
And you envision you will drop this bill when? Soon?
Soon.
Okay.
What does that mean? 10 days? Yes.
Okay.
We're tightening up the last, so to speak, bolts and nuts that need to be done, and we're going to go through its last check on it. We're going to encourage every single member of Congress, Republican and Democrat, to not only understand the facts of the case, but come join us, because we think this should be designed as a bipartisan bill.
Folks, thank you for being with us today, and Pete, thank you for being our guest today. Been a good show.
Well, Dr. Goodman, thank you very much. I look forward to coming back and giving updates about how we're doing with this. And the people that are watching should know they should encourage their member of Congress to come sign on also.
Absolutely.